On the top here, we're going to look at still is things that have no evidence, okay? On the right are things that there is strong evidence that there's a statistical association. So that can be thought of as, we're pretty sure about this. On the far left are things that we have strong evidence that there's no statistical association, that these things are not related. So on the left and right are things we know, and as we move in, we know them less, okay? Again, all this data is in a tabular form in the notes if you want it. And like I always do, I boxed bad things in red and good things in green. And then because the studies, what actually is being tested has to be tracked always, because a lot of times you're following retrospectively how many joints did you smoke a month, right? So that's the cannabis plant that has everything in it. Sometimes you're testing just THC. Sometimes you're testing just CBD. Sometimes you're testing the combination. And if you're smoking it, that can cause problems with the lungs. So my pictograms for that is, if you see this dropper with yellow, that's just pure CBD test. If you see a blue leaf, that's just THC. If you see a gradient leaf, blue to yellow, that's a mixture of THC and CBD. The ratio of colors is the rough ratio, right? And I did that based on the studies. So if 75% of the studies tested THC and 25 did CBD and found it to be effective, it would look like this. And then if it was a smoked marijuana plant, it's this green leaf with smoke. And just a green leaf is just marijuana, of everything in marijuana, maybe edibles, okay? Is that clear? It's a lot of, this is hundreds of pages of data I'm about to show you. So, correlation, there's a lot of bad correlation with cannabis, right? Now, this is a big take home back to like foundations and logic, the logic lecture that Gardner gave you. This is correlation. So this is, people have looked over the last 20, 30 years, and a lot of times there are high-risk groups that chose to use cannabis. And so we know it's correlated, we don't know it's causative. I'll get to causative in a moment. So in correlation, we know that smoking cannabis seems to cause psychoses. Not good, okay? It develops psychoses. If you smoke cannabis, it causes bronchitis. If a pregnant woman smokes cannabis, her child ends up small for gestational age. And the biggest one by far is cannabis is clearly linked with fatalities in driving, okay? I just watched, God, what was this? Galifianakis yesterday, had a thing on Netflix, not very good. But in it, one of his friends is like smoking a joint and hands it to him, and I'm like, this is just awful. This is because it's doing it as if it's a norm. It should not be a norm. Drinking and smoking cannabis causes the greatest level of accidents, okay? So if you know friends that do that, stop. Okay. More bad stuff. So that was very high level, statistically correlative, we know. Now this is still pretty clear. I would still trust this stuff, okay? And there's a lot of it that's bad. If you smoke cannabis, it hurts your learning in an acute fashion. So smoking cannabis Sunday night before your NEMS exam, horrible idea. Overdosing with cannabis is on the rise. A bunch of reasons for that. One is that the THC plants are being bred to have higher and higher levels of THC. And also there's edibles that are available now, and children are finding the edibles. If you have edible THC, it takes 2 to 3 hours to take an effect. If you smoke marijuana, it takes minutes to take an effect. So children can ingest large volumes of edibles and not have an effect till much later. And adults can too, because they don't know they've had enough already. Smoking cannabis is linked to an increase in...
I have a question. Yeah. I'm sorry.
Yeah.
What are you constituting as an overdose?
Hospitalization, I believe.
But this obviously is very different than an overdose that can kill you.
Yes.
So I'm just wondering what you're meaning by
this
overdose exactly.
Yeah, this is from a lot of studies, and the national academies summarize that it was very likely linked to overdosing, which in those studies, I think the general trend was going to the hospital. So not death. Okay, death would include that. But, and I don't know how they would actually link it if someone had enough and then got in a car accident. It's probably like an ICD-10 code where it gets binned as one and not both, even though it should probably be both, but I don't know that answer. Okay. It's linked to an increase, yes.
So, like, sometimes, well, I used to work in an emergency department, and people would, like, kids or I guess teenagers would come in after smoking, and they would, like, be paranoid, and that's why they came in.
Right.
But not necessarily because of, like, a physical symptom.
Right.
So that, I guess, like, that's kind of what you're saying. Like, what, like, is it because they've got heart rate problems? Is it because, like, they're nauseated? Or, like, what is it that is causing them to, like, what symptoms are they constituting as overdose?
Yeah, I'll look that up and try to get back to you. From memory, the summaries I read were hospitalization, so I didn't have that information. But that was from the Academy report. So if I went to the primary literature, it might subdivide hospitalizations, and I'll look into that for you. I'll post a Canvas announcement if I find it. Good questions. So it is linked to smoking cannabis, and so all of these have this green leaf. This is all general cannabis. It's not specific to THC or CBD. It's likely more THC, but the data wasn't split that way. It's linked to increased depression and suicide. There's been a rise in suicide. And I'm not saying that cannabis is the cause, but smoking cannabis does increase that risk. The linkage to substance abuse is mixed. I'll talk about that later, but the initial data was it seems to be linked to substance abuse. Increase to, I already had depression. It increases mania, increases in anxiety. Smoking cannabis, interestingly, the respiratory and cardiovascular effects are not what I would have expected. Okay, so long story short, the data shows it doesn't seem to have a ton of harm. So it increases forced vital capacity, airway dynamics, and it increases cognition through a variety of tests. Now we're down to there's some statistical association, but not strong. So this I would definitely take with a large grain of salt. So it increases prediabetes, okay? That's largely THC, so that's bad. But then it seems to decrease diabetes, which is good, and it decreases metabolic syndrome. Again, light correlation. It triggers myocardial infarction and testicular cancer, and that's through smoking of cannabis. It seems to decrease the symptoms of PTSD. Huge grain of salt on that one. I'll talk to it later. And it decreases the poor brain injury outcomes. So someone has a head hit and then self-medicated, and somehow they measured that over time, and it seemed to lessen the effect. Okay. So interestingly, there is no evidence, meaning we need to study it more. We don't know yes or no, if it increases the risk of MI and all-cause mortality, basically the take-home, right? Like, does this kill people? And so there's a very strong signal that there's no statistical association between smoking cannabis and lung, head, and neck cancer, which is surprising to me. But I would posit, totally pontificating, that that's because people aren't smoking 2 packs a day of marijuana, especially now moving to vapes and stuff. We can talk about that. That would be less of a issue. And so over here, there was a very bad thing where it clearly caused development of psychoses. It doesn't seem to worsen psychoses. So we know statistically, by statistical correlation, it doesn't seem to correlate with that. Okay, sorry. I shouldn't have said cause in any of that. All of that was correlation. Any questions about that? Because now I'm going to jump down to causation. Okay. So now, starting on the right side again, this is the kind of the stuff you want to care about the most, on the right and left sides, right? So on the right side, now we have all this positive stuff that we know is causative. It helps MS patients, okay? I'll show you a video where it's great. The CBD oil, the number one thing it can be used for and feel great for as a physician is using it to lower seizures, okay? It helps with nausea, so that you'll probably get right on the boards if they asked it because of the Hollywood effect. But so chemo patients, HIV patients that are low weight, it helps with that. There's an interesting caveat to that I'll come back to. And then it helps with pain. That one, there's some CBD data, but mostly THC. It helps with sleep. That's CBD and THC. So in Indiana, if a patient is having problems sleeping, aside from working on their epigenetic circadian cycle, you could have them get melatonin, CBD oil. All right. And so then the things that we're not as sure about, interestingly, it's very clear from the data, if you ask MS patients, how much does this help your seizures? CBD oil clearly helps. Strong causative effect. If you take the measurement from the doctor, then it's a slight causative effect. And so this comes back to the data you're measuring is a person saying how much it helped. It's not a blood test. It's not like measuring tremors, right? I'll show you a video that makes it pretty convincing that I think that one, at least for N of 1, worked. Okay, and so here I put them next to each other to show that in correlation, it seemed to not decrease symptoms of PTSD, but in causation, some data showed it seemed to decrease symptoms. So people are studying PTSD, we don't know. It seems to help with Tourette's, and again, HIV, it helps with appetite. All these things have been studied and do not seem to help. So people thought it would help with glaucoma, it doesn't seem to help. They thought it would help with MS pain, it doesn't seem to help there, and dementia doesn't seem to help there. All right, that was a lot. Any questions?